Hi, are you Mary Coffey?
Yes, hi.
Hi, nice to meet you. My name's Dr. Rupal Patel.
Hi.
I'm one of the learning disability doctors.
Okay, thank you for seeing me.
That's okay. So welcome to the clinic. I wonder what's brought you in today?
I've come about my brother Steve, who has Down syndrome, and I'm just a bit worried about him at the moment.
Okay. I might ask a few questions about your brother Steve. Can I first ask, how old is he?
He's 53.
Okay, and am I right in thinking that he has Down syndrome and a mild learning disability?
Yes.
Okay. What's happened? What's made you a bit more concerned about him?
I've just noticed over the last year he's deteriorated a bit, and things which he would normally be able to do, he started to either forget about or struggle with.
Okay, so it's happened in the last year. What kind of things is he struggling with now that maybe he wasn't over a year ago?
Well, he has a little part-time job in a shop, and he works 3 days a week, Monday, Wednesday, Friday.
Okay.
And he always used to know exactly when he was working, and now I'm having to prompt him about what day it is and the fact that he'll be working the next day.
Okay.
The shopkeeper said that he's a bit concerned because Steve's always been very good at counting money back.
Okay.
And he started to struggle with that.
Struggle with getting the right change?
The right change,
okay.
And sometimes either shortchanged or given too much money back. So I think the shopkeeper's just a bit tentative about him, whilst he used to be very happy just to let Steve get on with it.
And what kind of job is he doing, this 3-day-a-week job?
It's just a little corner shop.
Okay.
But he knows all the people who come in, and thankfully most of the customers who know Steve, if he gives them too much, will give it back. But obviously it's still not ideal that he can't count it out.
Okay, so there's been concerns about how he's been at work and remembering the days of the week, so remembering that he is working certain days. Have you noticed anything else? So okay.
He used to have a very kind of strict routine, which he used to be able to do himself in terms of in the morning, kind of shower, shave, teeth. He used to just be very independent and be able to do that.
Okay.
And now I've noticed on a few occasions he's got up, not even been to the bathroom, just literally put his clothes on.
Okay.
And when he's put his clothes on, his kind of vest's been back to front, or he's done the buttons up incorrectly.
Okay.
Things which he used to be able to perform perfectly.
Okay, but more recently he's had difficulties getting himself ready, putting his clothes on properly. Yeah. Okay. And how about things with, is he eating himself, so is he able to take his meals himself?
Yes.
And those kind of things?
Yeah.
Okay, good. And is he interested in his food?
Yeah, no, he's happy to eat. He's always got a good appetite,
okay.
Especially there's chocolate about.
That's good, don't we all? Okay, good. And what about things like travelling? So does Steve have difficulties travelling on the bus or?
No, he's usually quite good.
Okay.
And then there was an incident the other week though, which really shocked me. Okay. He was, meant to be going to the corner shop. I was cooking. He said he'd go out and get an ingredient we needed, and it would usually take him 15 minutes. And he's gone over an hour, and then the police brought him home and said they just found him wandering on the street, really disorientated, and he didn't know where he was. And that's really out of character for him, and obviously really concerning for me, because I suddenly wondered if he was vulnerable then, being out on his own.
Okay, so it's the first time he's gotten lost and not able to find himself home.
Yeah.
Okay, all right. So that is worrying. Okay, and that's the first time it's happened.
Yeah.
Okay, has it happened since?
No, but I've been mindful about where he's going and how long he's been, and kind of kept an eye on it.
Okay, so he's having so it sounds like Steve's having difficulties with things that he was usually able to do, so get himself to work and back, or kind of go out in the local area. What about things is sort of longer term memory? So does Steve have difficulties remembering things that happened a long time ago, maybe in his past?
No, he remembers very well.
Okay, so that's not something that you're concerned about. Okay. In terms of Steve's physical health, how has he been? Is he keeping well?
Pretty good. Yeah.
Okay, good. And what about in terms of sort of Steve's behaviour and his sort of personality? Have you noticed any changes in how he's been interacting with you or with people around him?
Yeah, he has a carer, Ben, and Ben has been his carer now for 10 years, and they usually have a very nice friendship. and Steve's always listened to Ben. And then over the last couple of months, there's been 2 different incidents where Steve's actually slapped Ben.
Okay.
The first time we decided to write off as just being a freak event, but then when it happened again, Ben's now quite reticent, I've noticed, when he comes round, and is actually doesn't get quite as close to Steve.
Okay, and what was happening in those 2 incidents when Steve slapped Ben?
On both occasions, Ben was trying to help Steve dress, because although Steve used to be able to dress himself perfectly, as I said earlier, buttoning, things on back to front, inside out, and Ben was just helping him.
Okay, and that's when that happened. Okay. Has anything like that happened at home? I'm assuming it's the 2 of you living at home together, is that right?
Yes.
Yeah. Has any kind of incident like that happened?
No.
No. Okay. It sounds like he's having difficulty sort of with getting himself ready and also going out on his own.
Yeah.
Have you ever been concerned about Steve being a risk to himself or harming himself?
Only when he got lost.
Okay.
I panicked.
Okay.
Because that's never happened before, and I suddenly thought, what would happen, if he was on a main road and suddenly forgot, or if somebody kind of abused him in some way because he was looking vulnerable.
Okay.
So a whole set of new fears did arise from that event.
And I wonder what you've talked about today with the difficulties in his memory and the sort of changes in his behaviour. Maybe it looks like the changes could be due to something like dementia. But what I'd like to do actually is, having spoken to you now, is arrange some tests. So that would include some blood tests, but also doing some specific tests on Steve's memory to see if that's the likely diagnosis, and then we can take it from there. Does that sound okay?
Okay.
Okay, thanks. So in this station where you're asked to elicit a collateral history from a carer, it's important to get some more information about changes in both short-term and long-term memory. Also to ask about changes in personality and behaviour. So in Steve's case, there was some aggression towards his carer, which was new. It's also good to screen for physical health problems as well, and also to do a focused risk assessment. So to ask about risk to self, risk to others, and also, as in Steve's case, a risk of self-neglect. And also, if you're thinking about a diagnosis of dementia, we need to remember that in people with Down syndrome like Steve, the dementia process can start a lot earlier than in the general population.